You know that sound, right? That high-pitched whine, especially during monsoon season. A single mosquito bite. For millions of people, that tiny moment can be the start of a journey from a simple fever all the way to a full-blown medical emergency. Today, we're going to break down dengue. So that's the big question we're tackling, isn't it? How does something so common, so seemingly small, become so incredibly dangerous? To figure that out, we really need to follow the path of the virus itself, from the moment it enters the body. All right, first things first, we gotta know our enemy. What exactly is dengue? Well, it's a story that involves a specific virus, a specific mosquito that carries it, and a really important twist that makes this disease particularly tricky. At its very core, dengue is a viral infection. And a key thing to get right away is that it's not something you catch from another person like the flu. It has to be transmitted by a carrier, a vector, and in this case, it's the Aedes aegypti mosquito. This is exactly why we see outbreaks pop up in specific regions and during specific seasons, like the monsoons in India. And here's that twist I mentioned. This number 4, it's absolutely crucial. You see, there isn't just one dengue virus. There are 4 distinct types, or serotypes. And this is a total game changer. It means you can get dengue, recover, and then get infected again with a different type. And that second infection, that's often where the real danger begins. This also highlights a huge difference in how we approach diseases. With a bacterial infection, the playbook is often, here, take these antibiotics. We go on the attack. But with a virus like dengue, there's no magic pill. The entire strategy shifts. It's not about killing the germ directly, it's about playing defense. It's about supporting the body, managing the symptoms, pushing fluids, so it has the strength to win the fight on its own. So you might be thinking, okay, if the treatment is just support, how does it get so serious? Well, this is where we have to trace the path of the illness itself, because the journey from a simple fever to life-threatening shock can happen, and it can happen fast. Knowing these stages is absolutely critical. Now, I know this table looks a little intense, but it's basically the roadmap that doctors use to track the disease. Almost everyone starts up at the top with dengue fever. The fever, the headache, the body aches. But the real story is what happens in the lab results as you go down. The big danger sign is when the HCT, or hematocrit, starts to climb by more than 20%. That's a huge clue that the watery part of your blood, the plasma, is leaking out of your blood vessels. At the same time, your platelets, the little guys that help you clot, start to plummet. That's the turn. That's when we start talking about dengue hemorrhagic fever, and at the very bottom, dengue shock syndrome, where the body's circulation itself begins to fail. This progression is exactly what doctors are trying to prevent. So, how does a doctor spot that critical shift from a simple fever to that more dangerous phase where plasma starts leaking? Well, one of the classic old-school tools they use right at the bedside is something called the tourniquet test. It might sound complicated, but it's a remarkably simple and honestly pretty clever test. All they do is put a blood pressure cuff on the arm, inflate it for 5 minutes, and then release it. If the tiniest blood vessels, the capillaries, are fragile and leaky, which is a hallmark of developing DHF, these little red spots called petechiae will appear on the skin. If you can count more than 10 of those in a small 1 square inch area, that's a positive result, and it's a major clue that the disease is getting more serious. Okay, we've now arrived at what might just be the single most important section of this entire explainer. We're talking about the crossroads of the illness. These are the critical warning signs that you absolutely, positively cannot ignore. Recognizing them can be life-saving. So please pay close attention here. This is a level up from the initial fever and aches. We're talking about major red flags. Things like severe pain in your stomach, vomiting that just will not stop, or any kind of unusual bleeding from your nose or gums. If you notice a sudden change where someone is extremely sleepy and hard to wake up, or the complete opposite, they're super restless and agitated, that's a huge signal. Any one of these signs means the situation has changed. It is time to get medical help immediately. And just to be crystal clear, these are not symptoms you just try to tough out at home. Think of them like fire alarms going off in the body. They are a signal that the disease is shifting into a much more dangerous gear, and you need professional medical help to prevent that slide into shock. So, you spotted a warning sign, you've gone to the hospital. What happens next? How do doctors actually step in and manage this illness when it starts to get severe? The management strategy really splits down two different roads. For mild dengue without any of those warning signs, it's all about supportive care at home, rest, using paracetamol to control the fever, and it's so important to avoid NSAIDs like ibuprofen or aspirin, and drinking plenty of oral fluids like ORS. But the moment those warning signs appear, the patient belongs in a hospital. The core of the treatment immediately shifts to intravenous fluids and constant, close monitoring of vital signs and blood work. And why are IV fluids so critical? Well, it all comes back to that fundamental problem in severe dengue. That plasma, the liquid part of your blood, is leaking out of the blood vessels. This is what causes blood pressure to drop and leads to shock. So the entire goal of hospital care is this delicate balancing act, meticulously replacing that lost fluid to maintain circulation and keep the organs working, but without overloading the body. It's a real tightrope walk. Now, a really common question people have is, hey, if the platelets are low, why not just give more platelets? But it's really not that simple. Doctors are extremely careful with transfusions. They reserve them only for the most critical situations, like a major life-threatening hemorrhage. For most patients, even if their platelet count looks terrifyingly low, the main focus remains on that careful fluid management, not just trying to top up the numbers.
And that really brings us to our final thought. The whole story of dengue management is a powerful reminder that in medicine, sometimes the biggest, most important fight isn't about killing a germ. It's about meticulously supporting the body so it can fight its own battle. And it really makes you wonder, doesn't it? What other diseases out there challenge our common "a pill for every ill" mindset? Thanks for joining us for this explainer.